Hello everyone. Today we are taking a deep and evidence-based look at lemongrass. Not just as a fragrant herb in your soup or tea, but as a plant with real biological activity in the human body. I will walk you through what it is, what is inside it, what human studies say, how much to use, and when to be careful. Let us begin with the plant itself. Botanical and historical background. Lemongrass belongs to the Poaceae family, which is the grass family. Its scientific name is Cymbopogon citratus for West Indian lemongrass and Cymbopogon flexuosus for East Indian lemongrass. These are the two major varieties used for food and medicinal purposes. It is native to South and Southeast Asia but is now grown widely in Africa, including Nigeria, and in tropical regions around the world. Traditionally, lemongrass has been used in Ayurveda and traditional Chinese medicine for fever, digestive problems, infections, and calming the mind. In many African and Asian homes, it is prepared as tea for malaria-like symptoms, stomach discomfort, and general wellness. In cuisine, it is common in soups, curries, and herbal drinks. Now let us look at what gives this plant its biological power. Bioactive compounds and chemistry. The main active compound in lemongrass is citral. Citral is actually a mixture of two isomers called geraniol and nerol. It is responsible for the strong lemon aroma and many of the antimicrobial and anti-inflammatory properties. Other important compounds include myrcene, geraniol, limonene, flavonoids such as luteolin and quercetin, phenolic acids. These compounds are volatile. That means they can be lost with excessive heat or prolonged boiling. Crushing or chopping fresh lemongrass before use helps release more of the essential oils, including citral. Gentle simmering preserves more of these compounds compared to long, aggressive boiling. Drying the plant reduces some volatile oils but concentrates certain polyphenol. Aged extracts used in supplements are often standardized to citral content, but the stability depends on proper storage away from light and heat. Citral is fat-soluble. So pairing lemongrass with healthy fats such as coconut milk or adding it to soups with oil can improve absorption. Now let us examine its nutritional profile. Nutritional profile. Lemongrass is usually consumed in small amounts, so it is not a major source of calories or protein. However, it does contain small amounts of vitamin C, vitamin A, folate, magnesium, potassium, iron, zinc. It also contains antioxidants, mainly flavonoids and phenolic compounds, which contribute to its biological effects. When consumed as tea, the micronutrient contribution is modest. The main benefit comes from its phytochemicals rather than macronutrients. Now let us focus on what human research says about its health effects. Evidence-based health effects. Cardiovascular effects. Some small human clinical trials have studied lemongrass tea in individuals with mild hypertension. In one controlled study, daily intake of lemongrass tea for several weeks was associated with modest reductions in systolic blood pressure compared to baseline. However, the sample sizes were small, and more large-scale trials are needed. There is limited human evidence suggesting that lemongrass may help improve lipid profiles. Most lipid-lowering data come from animal studies. So at this stage, we can say lemongrass may support cardiovascular health, but it is not proven to treat hypertension or high cholesterol. Antimicrobial properties. Human trials directly testing lemongrass in infections are limited. However, clinical studies using lemongrass essential oil in mouth rinses have shown reductions in oral bacteria and plaque formation. Some small trials suggest it may help with oral candidiasis when used topically. Most antimicrobial data are from laboratory studies. In humans, it may support oral and skin hygiene, but it should not replace prescribed antibiotics. Anti-inflammatory and antioxidant mechanisms. Human studies measuring antioxidant markers show that herbal teas rich in polyphenol, including lemongrass, can increase total antioxidant capacity in plasma after regular intake. Citral has shown anti-inflammatory effects in laboratory models, and small human studies suggest a potential reduction in inflammatory markers, though data are still limited. So we can say lemongrass may support the body's antioxidant defense system, but it is not a cure for inflammatory diseases. Potential anti-cancer properties. There are laboratory studies showing that citral can induce apoptosis in certain cancer cell lines. However, these are test tube studies. There are no strong human clinical trials proving that lemongrass treats or prevents cancer. At best, we can say it contains compounds with promising anti-cancer mechanisms in early research. It should never replace standard cancer treatment. Immune modulation and respiratory health. Traditionally, lemongrass tea is used for colds and coughs. Human evidence is limited, but its antimicrobial and mild anti-inflammatory properties may help relieve symptoms. Warm herbal fluids themselves also support hydration and mucus clearance. Some small clinical observations suggest it may have mild calming effects, which can indirectly support immune balance by reducing stress. Blood glucose regulation. A few small human trials suggest that lemongrass tea may modestly reduce fasting blood glucose in individuals with elevated levels. However, evidence is not strong enough to recommend it as a primary treatment for diabetes. It may support metabolic health as part of a healthy diet, but patients on medication must monitor blood sugar carefully. General body system effects. Digestive system. Lemongrass tea is commonly used for bloating and mild stomach discomfort. Human data are limited, but it appears safe and may promote mild diuretic effects. Nervous system. Some human trials suggest mild anxiolytic effects from lemongrass tea, likely related to its aroma and phytochemicals. Renal system. It has mild diuretic activity in small human observations. People with kidney conditions should consult their doctor. Now let us discuss how to consume it properly. Optimal consumption practices. In human studies, typical intake ranges from 1 to 3 cups of lemongrass tea per day. This is usually prepared using 1 to 2 teaspoons of dried lemongrass or 1 fresh stalk per cup of hot water, steeped for 5 to 10 minutes. Raw lemongrass is often too fibrous to chew but can be finely chopped and added to meals. Cooked lemongrass in soups and stews is effective, but avoid overcooking for long periods to preserve volatile oils. Standardized supplements often provide 300 to 600 milligrams of extract per day, but quality varies. Look for products standardized to citral content and tested by third-party laboratories. For better absorption, combine lemongrass with meals containing healthy fats. Now, safety is very important. Safety and contraindications. Lemongrass is generally safe in food amounts. In high doses, it may cause stomach upset, dizziness, or allergic reactions in sensitive individuals. Because it may have mild blood-thinning properties, people taking anticoagulants such as warfarin should consult their doctor before regular or high-dose use. It may also slightly lower blood pressure and blood sugar. Those on antihypertensive or antidiabetic medications should monitor levels closely. Pregnant and breastfeeding women should avoid concentrated supplements due to limited safety data. Before surgery, it is wise to stop high-dose supplements at least 2 weeks prior due to possible bleeding risk. Essential oils should never be ingested directly unless under professional supervision. Finally, supplement quality is a concern. Not all products are standardized. Look for reputable brands with clear labeling of citral percentage and third-party testing. In summary, lemongrass is a valuable herbal plant with promising benefits for cardiovascular support, antimicrobial action, antioxidant protection, and mild metabolic support. However, most strong evidence in humans is still limited or small-scale. It may support health, but it does not replace medical treatment. If you found this detailed review helpful, please subscribe to the channel, like this video, follow for more evidence-based nutrition content, and share this with someone who loves natural health. See you in the next video.